Welcome to Oral Design Dental, Utah's superior choice in dental care. From the moment you walk into one of our clinics, you'll see a mixture of modern technology along with decades of experience. Beginning with our fully digital registration, charting, and record keeping that come together to provide you with a comfortable, worry-free experience. We are proud of our highly capable staff. They are always friendly, responsible, and knowledgeable in treating every patient with respect, integrity, and loyalty. Our professional and experienced dentists continue to impress our patients. They have more than 20 years of experience, and some of our dentists have achieved the title of America's Best Dentist in 2015 and 2016 by the National Advisory Board.
I'm Dr. Darren Gardner. I graduated from Virginia Commonwealth University 2004, so I've been practicing for about 12 years. Did a residency at the University of Utah. I enjoy dentistry. Things that I like about working for Oral Design is one, the people. That's really important, is who you work with, and we've got a good staff here that are genuinely interested in the patients and doing the best for the patients. The fact that we have a dental lab here right in-house, that's a dentist's dream, because anytime we have a change that needs to be made, we can just run it downstairs and we can talk right directly to the lab and make those changes.
I am Dr. John Day. I graduated from the University of Pittsburgh. I've been practicing now for about 25 years. The one thing I like about working at Oral Design is that I can give people what they want. I can take somebody and sit them down and not only tell me what they want, but then after we start doing the case, they can go back and sit with the lab technician. And these men are artists. Anything can be fixed in 20 minutes, and so people are walking out the door with exactly what they thought they would get. And to me, that's the most important thing.
Hi, I'm Dr. Rochelle Rasmussen. I'm a dentist here in Utah, and I currently practice with Oral Design Dental. I graduated from Creighton University in 1994. I've been practicing for 22 years. Over the years, I've been able to work with many patients who are self-conscious about their smile, and I've been able to help transform some of these patients with beautiful smiles. And it's one of the most rewarding aspects of being a dentist, and something that satisfies me personally as a doctor in making a difference in my patients' lives.
My name is Chris Rosander. I graduated 14 years ago from the University of Pacific in San Francisco, and I've been working at Oral Design for about 6 years. A couple of the procedures I enjoy are maybe crown and bridge, and then also implants. I think we get to combine the creativity of what we do, use our hands, and then also make a big improvement in patients' smiles. What I like about Oral Design, I think it's a relaxed, friendly atmosphere, and I think we listen and we really care about our patients.
Hi, I'm Dr. Scott Drury. I've been practicing here in Foothill Village for the last 31 years. Began in 1985. Graduated from the University of Utah. Got my training at Georgetown University, and came back, decided to practice in Foothill Village. Had an opportunity to practice up in this area, and have practiced here ever since.
These same-day crowns are unbelievable. Back in the day, back in the ancient days, of course, we'd do the little metal cap, and then we'd do the wait a couple weeks, and then we'd get the fitted in and everything else. Then Scott got his machine, and this thing that's just way smarter than any human being, that can just take a blank of nothingness and turn it into a tooth. But it is amazing to come in here and to have, a problem, a really serious problem, and just wait. Same day, have it completely finished, have it look just like a tooth.
That's sort of the technology. We can do it all in one step. It alleviates the need for temporary crowns, and it eliminates the need for an extra appointment. So essentially, we're doing everything in a single appointment. It takes about an hour and a half. to get everything processed and done. What we're using is CADCAM technology, which is camera-aided design, camera-aided manufacturing, very similar to 3D printing. The machines are very accurate. Essentially what we do is we will take digital images of teeth once they're, of the teeth before preparation and once they're prepared, and then we'll design digitally a crown on the computer itself, and then we'll send those images to the printer, and the printer will manufacture a crown. And these crowns are full porcelain. There's no metal in them, so they're extremely aesthetic. In my clinical experience, the tissue health around these crowns is superior to what we used to do.
We are proud to have our own full-service dental laboratory at our Holiday location. Equipped with the industry's top artisans and skilled techs that are well known across the country.
Hi, my name is Armand. I'm one of the designers here at Oral Design. It's a really exciting time to be in the dental field because with CAD-CAM technology, we're able to make alterations before they're actually put into the mouth. So if you take a look here, this is one of the examples that we have done. You can actually see the teeth of how the doctor has prepped them, and we're able to build full restorations on top of those within micron precision, more accurate than any other hand can do. And so it's very interesting to see how technology has changed from where it's been to where it is now.
The laboratory selects many different materials such as cubic zirconia with extreme translucency. Once the restorations have been designed, it is the job of the Axis CAM machine to produce them. The computer-animated milling machine is accurate down to the 100,000th of an inch. That is less than 1/10 of a strand of hair. The next process, sintering, hardening, and coloring the tooth, is an amazing process that includes special furnaces designed specifically for the job. Our shading technicians have hundreds of collective hours of experience in this specialty. The process then relies on the skilled hands of a ceramist that is able to custom match the shade of your new restoration to your own natural tooth color.
I've been doing it for 25 years. My whole family pretty much makes teeth too, so I kind of fell into it. Ceramist for Oral Design, I just got through doing a full mouth reconstruction on myself. From the doctors to everybody that worked on me, it all went perfect. Very good. I'm very satisfied with it.
My name is Mike Manning. I'm in the scanning, designing department. I got started about 36 years ago. The stuff you can do with this CAD-CAM, the fit is incredible, materials are inexpensive and very aesthetic, and they're coming out with new stuff all the time. But we always stay busy because there's those dentists who work for Oral Design, outsourced dentists who work or send their work there, and it just keeps you busy. And you're on spot to do whatever needs to be done. If there's a problem with the dentist office, if you want to change a shade, you want to add a contact, you want to make something fit better, and these are often things that can be done within the visit of the patient. Sometimes maybe it's an hour and it's an easy comeback. We can get the dentist and the patient, happy with what the product that is there. Send them home, they're pleased.
My name is Valeria Dubil and I'm a dental hygienist. I also provide oral health education for my patient. I encourage my patients to use floss, power toothbrushes, proxy brushes, or water picks. And of course, we recommend to come and see us every 6 months, 2 times per year for regular checkups and exam. We also provide lots of home care education, especially for patients with dental implants and with orthodontic appliances.
I think our biggest difference is our ability to communicate and our emphasis on communication. We try to create an environment where the patient can ask a lot of questions, where they're getting a comprehensive treatment plan and that treatment plan is explained to them. We really want them to leave with all their questions answered, whether that applies to insurance or something that they might end up doing a year or 2 down the line. Our goal is that they leave with an idea of their oral health, so that they're not just coming in when they have a toothache or every 6 months, but so that they can maintain their oral health every single day. It's a kind of communication that I think is the foundation of our company. It happens at every level.
My name is Luz Lara. I am from Taylorsville, Utah, and I've been a patient of the clinic for about 7 years. Really great experiences here. Every time I come, I get a great customer service. They are awesome professionals. They really know what they are doing, and most of all, they make me feel that I'm taken care of. The main things I like is that every time I come with a problem, they are very savvy and they provide me with guidance on what to do or what to avoid, and treatment to follow up. And it doesn't matter how many times I ask the questions, they are always very polite and nice. I have recommended already the clinic to several members of my family, and I would continue to do so because my experiences so far have been great. And I really want my family members to have great service and great professionals taking care of their oral needs.
And I've been a patient with Oral Design for the 3 years I've been here in Salt Lake City, Utah. I really enjoy this office. I think one of the biggest things I like about it is that I feel the honesty from ground up, from the general office manager to the dentist. Everything's explained to you. And I feel like they take good care of you from the standpoint that they don't force complicated procedures on you if they don't feel it's necessary. They take precautionary measures to make sure that you do what needs to be done, but they don't go over the line with that, and we really appreciate it. I would recommend them to my family and friends because I trust them.
Hi, I'm Mona, and I live in South Jordan, Utah, and I love going to Oral Design. I looked through the phone book, and I had found Oral Design, and I talked to George, and George told me to come on in. I had an appointment the next day, and I was really worried about my appearance. So he told me to come in, and they did impressions, they took good care of me, and they called me in the next morning and said, come and try your teeth. They fit, they were perfect, and everything turned out great.
The main idea of creation Oral Design was integration of dental offices with a doctor specializing in the different aspects of dentistry and state-of-the-art dental lab. It's so many benefits of that integration because we avoid any kind of misunderstanding between the office side, I mean the doctors who is doing procedures, and the dental lab, manufacturer of dental prosthetics. Our patients always have ability to choose the shape, the shade, and the size of the restorations. Often they just come in with some kind of magazine or picture to show us what kind of smile they prefer. And we, all Oral Design team, working hard to achieve that result. That kind of approach helping us to step forward and become one of the leaders of dental industry.